I think the center's work has been so critical in so many different pieces of things that are happening across the state when it comes to healthcare services within the state. And because they've been in the background, we almost don't even recognize how much they've really helped push the envelope and push things forward.
They are really in issues for the long term, which is unusual, but I think they see that as core to their mission, and I think that everybody that works with them values them as research partners, but also program and policy partners.
One of the center's most significant accomplishments, I would say, is this trusting relationship that they have developed, formed, intensified, that needs to be sustained.
I've had the privilege of working with Joel and Margaret for almost the entire time I've been in the legislature. They worked with me on my work group to expand healthcare for kids, Medicaid ACOs, and a whole list of things that healthcare initiatives that were important to the state, not just to children, but to adults as well. They've been part of really a team that's volunteered to help us forge good state health policy.
The fact that they have been able to, over a period of 8 governors, I think, and counting, is really just a testament to the quality of the work that they do, the relationships that they value, and the work product that they have produced in partnership with the state. And under Joel and Margaret's leadership, that partnership continues today.
Most of our clients are not housed. They have substance abuse and mental health issues. With Rutgers, we were able to actually show the parts of that program that did work. And it was just incredible to really work with them on that, to parse out what we needed to keep doing, what we might need to change, and why it was important to continue this work for New Jerseyans who really, really are our most vulnerable residents.
One of the first studies that we did with the center, we saw that there were a lot of people who had high medical needs that we never really understood their medical needs in the homeless service system. And so it helped us think about different ways of connecting with folks, different ways of asking them about their healthcare needs, and actually opened up a lot of communities to starting to focus more on health needs of folks who were experiencing homelessness as opposed to just the housing crisis that they were experiencing. They continue to work with us to figure out how we can better improve our services for folks, how we can better coordinate systems to make sure that we're really impacting people in a positive way so they can live healthier lives.
There's always been such positive intent coming from them at all times, never a gotcha, always a focus on what are we trying to figure out here? What's the data telling us? And that's really the foundation and focus of their work.
They are actually trying to figure out how the information that they are obtaining will be helpful to the partners, the organizations, and the people that they're working with.
We have had an opportunity, I've had an opportunity to work with Joel and Margaret for 10 years now, and each time we connect, we talk about what's the next thing that we could be looking at, what's the next thing that we could be working on to really move our community forward.
I think it's really, really important for us to take a moment, not take the center for granted for just this moment, and think about, 25 years ahead, hoping that they continue to be with us, helping the state on really vital health and other important policy issues.
For the past quarter century, in every gubernatorial administration, this center has informed and supported major progress in our state's health policy. And none of our shared accomplishments would have been possible without Dr. Joel Cantor and Margaret Kohler at his side, who have fostered the center since its earliest days into the state and national leader in health policy and research that it is today. New Jersey is a state that is proudly home to some of the greatest healthcare providers and public health professionals in the entire world. And we're also a state dedicated to ensuring that our world-class healthcare system is accessible to every one of our neighbors, regardless of their economic status or their zip code. And that's exactly why we are so grateful to have partners like the Rutgers Center for State Health Policy. Together, by partnering and combining the best in public service and academia, we have established benchmarks to monitor and slow the rate of healthcare cost growth throughout our state. We've fueled innovative population health research using governmental health data to help us address priorities including the opioid epidemic, COVID-19, and social determinants of health. And we have also begun to address the unacceptable and preventable maternal and infant deaths across our state. When I first sat down at my desk in the state capitol back in 2018, New Jersey ranked 47th in the nation for maternal mortality. And changing that disgraceful reality has been one of our top priorities since day one. And today, 6+ years later, with the center's dedicated support, we've been successful. New Jersey has jumped up the list and now ranks at 27th in the nation for maternal mortality. Of course, we still have a long way to go, especially to eliminate the persistent racial and ethnic disparities, but we are saving lives every day. And we won't stop until every mother and every child gets the care they deserve. And I know you will always be right by our side in this effort. So congratulations again on 25 unparalleled years, and I wish the center the very best in the next 25 years to come as we continue working together to improve the health and wellness of every New Jerseyan.